And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. This is Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative, and a lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free at 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Well, I want to talk about arthritis and osteopenia and osteoporosis and low back problems, sciatica, back pain, restless leg syndrome, degenerative disc disease, joint replacement, all that kind of stuff, because the medical system has approached this entirely 180 degrees incorrectly. Even the New England Journal of Medicine, big Harvard study, said in 2002, came out and said, oops, knee surgery is what they said. Knee surgery for arthritis is absolutely worthless. That's Harvard Medical School, published in the New England Journal of Medicine in July 2002. Surgery for arthritis, knee surgery for arthritis, is a worthless procedure, yet it's still the bread and butter surgery for orthopedic surgeons. Then 4 years later, in the Journal of the American Medical Association, big headlines, low back surgery worthless for sciatica, low back pain, degenerative disc disease, restless leg syndrome. And so why do doctors still do this? Why do they lie to their patients and say, oh, listen, there's no way you can regrow disc. Those quacks, there's no way you can regrow cartilage. When the pain medicines don't work anymore, the only thing for you is joint replacement surgery or back surgery. We got to take out what's left of your disc, your bulging and your ruptured disc, and we got to put in some mechanical device or fuse your vertebrae together. Well, give me 60 days. This is Dr. Joel Wallach. Remember, I'm a veterinarian and a physician. And in veterinary medicine, we don't have personal insurance for animals or government insurance for animals. And so when a pig has double knee replacement requirements, right, when if an orthopedic surgeon for humans would say, well, that pig has bone-to-bone arthritis in both of his knees or both of his hips, he needs double joint replacement, he becomes bacon, because there is no money for a stupid thing like that. So we learned a long time ago, even rheumatoid arthritis, we learned 60 years ago, was a simple infection with a bug called mycoplasma. And we learned how to get rid of rheumatoid arthritis. I mean, get rid of it, right? In animals 60 years ago. Very simple disease to get rid of. 85% of animals and people with rheumatoid arthritis get osteoarthritis at the same time. So what I do is I use the approach for animals, and I deal with the infection as well as the degenerative arthritis or osteoarthritis in the same person. And guess what? When you approach it from that way, you get remarkable beneficial results. We can support and promote healthy maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between your vertebrae and bone matrix, bone itself. Contact your longevity associate and say, what is Dr. Wallach ranting and raving about? That we already know how to support and promote maintenance repair of cartilage and ligaments and tendons and connective tissue and disc between the vertebrae, bone matrix, and bone itself, using little nutritional programs. That is correct. And so what I want you to do is contact your longevity associate. If you have arthritis, if you have bone-to-bone arthritis, if you have low back pain, if you have sciatica, if you have restless leg syndrome, if you have osteopenia or osteoporosis, bone spurs, bone calcium deposits, you have any of that kind of stuff, what I want you to do is contact your longevity associate. Okay, Dr. Wallach says give you guys 60 to 90 days. Yeah, give us 60 to 90 days. You can always get the surgery, right? If we fail you and cannot meet your requirements for, let's say your goal is to get rid of your joint pain and increase your joint range of motion, stop all the crazy popping and clicking as you go up and down the stairs, what if we can do that in 60 days? Why on earth would you want to get joint replacement surgery in your knees, your hips? Why would you want to get back surgery? You see, You can always get the surgery, but you can't always get unsurgery, uninfected, unparalyzed, and undead. This is what these articles are saying. Remember, JAMA, the Journal of the American Medical Association, we're talking about 2006, said, back surgery for sciatica and all this other things associated with it, like low back pain, hip pain, peripheral neuropathies, numbness, burning in the feet, restless leg syndrome, degenerative disc disease. Why would you want to have surgery when you can solve the problem with a nutritional supplement program? Same thing with knee replacement or hip replacement surgery for bone-to-bone arthritis. Why on earth would you want to risk the surgery without first giving it the non-destructive, non-surgical, non-dangerous thing first, non-invasive stuff first? Give me 60 to 90 days, and let me give you a program that's totally nutritional. We will give you the nutritional program that will support and promote healthy maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. And if you're, we have all kinds. We can even do it for vegetarians. We even have programs for vegetarians where you can do it for vegetarians. I don't care what your eating habits are. If you're allergic to this or that or the other, we can make it happen. It's amazing what we've learned how to do. Give me 60 to 90 days. You can always get the surgery if I fail you. It just, cost you a couple of bucks a day. Truly, depending on your body weight, anywhere from $2 to $5 a day, $2 a day for somebody 130 to 150 pounds. For 150 to 200 pounds, it might cost you $5 a day. For say 90 days, and we'll cut that by 30% off for maintenance. These nutrients are required every day, every minute of the day, just like oxygen and water. The reason why you have problems is not because you don't have a good surgeon, it's because you don't have the nutrients. So give me 60 to 90 days. You can always get the surgery. Remember, you cannot get unsurgery, uninfected, unparalyzed, and undead. Contact your Longevity associate today and say, okay, let's test Dr. Wallach out here and see if he's just spitting in the wind or if he can really do something. We'll be back with Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity. And if you want to find out if I have a big mouth, just with nothing really to say, just ranting and raving for nothing, or if I really have something going here, contact your Longevity associate and ask for that CD, Dead Doctors Don't Lie. Ask for the book, Dead Doctors Don't Lie. And then ask for the program to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between vertebrae, bone matrix, and bone itself. Give me 60 to 90 days to deal with your osteopenia, your osteoarthritis, your osteoporosis, your low back problems, your sciatica, your restless leg syndrome, your peripheral neuropathies, burning, numbness in the feet. You can always get the surgery, but you can't always get unsurgery, uninfected, unparalyzed, and undead. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about medication.